researchers discover a cluster of pneumonia cases in the city of Wuhan, China.
First known death from the new virus. The victim, a 65-year-old man, a regular customer in a popular market in the city of Wuhan, China. The new virus quickly spreads throughout new places in Asia, including Japan, South Korea, and Thailand.
The United States confirms its sixth case, the first person-to-person transmission of the coronavirus in the country. WHO announced that on February 25th, China was no longer the country with more COVID-19 cases.
The World Health Organization has declared a global health emergency.
The United States registered more than 140,000 coronavirus cases, more than any other country in the world.
On May 5th, the number of cases globally surpasses 3.5 million.
After 40 days, 213 people have died, and 98,000 people have been infected worldwide.
New cases of COVID-19 increase exponentially around the world, rising.
We are in a constant fight for survival. Amazing it is to feel the tender moment when the sunlight warms your skin. When you take the first deep breath in the morning, a gift it is indeed to breathe freely without a worry. The true beauty of it all is that it doesn't matter if you wake up in wild Africa, in cheerful Colombia, enigmatic Thailand, rural Texas, or cosmopolitan New York. The nice feeling, it is always the same. It's a blessing to embrace the delicacy of the world through our senses. But something has changed. Can we think and function when our hearts and our spirits are shattered? Can we smile after it all happened so fast, unexpectedly? Where do we stand now? Where did it all go wrong?
My name is Ricardo De La Fuente, and humanitarian efforts have been central to my life and work. During COVID-19, I asked myself, how did this happen? So I decided to delve into the pandemic's effects. Let's discover how to transform and adapt, learn what mechanisms we should implement to be emotionally sound, what is ahead, how people cope with a new normal, and continue to face challenges with resilience and empowerment.
We're talking here with Dr. Jacob Glanville, an entrepreneur, inventor, computational immunity engineer. So thank you so much for taking the time with us. It's very important. We want to hear your perspective on things. I know you're working on finding a cure, a vaccine. So when is the first time that you heard about the coronavirus?
The first time I heard about it was in early January, and we had heard the reports coming out. I'm a viral geek, so I was very interested. But it felt very far away. It was a small outbreak in China. January 22nd is when China quarantined 57 million people. And for me, that's when I was like, wow, we have a real problem here. And then the next week, I flew over to Washington, D.C. and I was going to a conference called the Biothreats meeting. And so we show up, and the conference is in the first floor of a hotel, and my family were staying at the 5th floor. I go down, you know, my little coffee in hand Monday morning, and I see Anthony Fauci up there, and he's presenting to a freaked out audience where he's like, we have to be realistic that this virus is no longer containable in China. And I'm looking around, and I notice Fauci's not shaking anybody's hand. And I suddenly realized that this conference, the people flew all the way around the world where they researched dangerous viruses. Like, this virus could already be in the building, and my family's upstairs.
Back in January, most of our nations lived in a bubble, thinking that no consequences would come from this coronavirus pandemic. We witnessed many of our leaders and so-called experts downplaying the virus, letting us believe we were all safe.
Como les digo, este patógeno no requiere unidades de aislamiento de alto nivel. Lo cierto es que la incidencia de la gripe es muy superior a la que pueda tener el coronavirus. No es necesario que la población utilice mascarillas.
Estamos preparados para enfrentar esta situación del coronavirus. El escudo protector es la honestidad.
Because of all we've done, the risk to the American people remains very low. We have the greatest experts in the world, really in the world, right here. It's a little like the regular flu that we have flu shots for, and we'll essentially have a flu shot for this.
But the reality was very different. Have you been a nurse for a while? How long have you
I've been a nurse for 14 years.
Oh, wow. Thank you so much for your service.
Oh, anytime.
So tell me, I want to hear a little bit about your experience, like, you know, pre-COVID, post-COVID. Have you seen a lot more activity?
Well, when COVID first started, I guess I was still working in the emergency room. And it was around, I guess, maybe October, November, when people started coming in with a higher influx of respiratory distress and pulmonary issues, but we didn't know at the time what was causing that. We were seeing a higher number of cases, but we just weren't understanding like why there was such a bigger rise. One of our nurses got really sick and she was in the hospital. She had trouble breathing. She had a really dry cough. It was kind of like the flu, but it wasn't, so we just couldn't put our finger on what was going on with her. But we didn't know that COVID was in existence at that time.
Is this like a flu? Is this something way more serious? Is it just good branding? Why is this more of a threat than the flu?
So there's a couple things that make this different than the flu. So it's compared to the flu because it's a lung infection, upper respiratory disease. But here are the areas where it's different. One, it's a very different type of virus. That's important because it's a novel virus, and that means that there's no immunity. So for most of the flus, the human population has had some level of immunity from prior exposures or from vaccination. Whereas this thing, you have an entire population that is naive. They haven't been exposed to this coronavirus. There seems like there's a little bit of very weak cross-reactivity between very distant cousins of coronaviruses that cause common colds and the novel coronavirus. It's confusing to us whether that's actually helping or harming previous immunity and what that means for people that are newly infected, but there's nothing close.
I actually contracted COVID in June, so I was quarantined for 2 weeks. It felt real once I started seeing the patients that were declining not come back from that. Like they would start on they would be intubated, and then they would either get a trach or other kind of respiratory support, and then some of them just didn't survive. And I was like, oh, sometimes we would have 2 deaths back to back in the same day in the COVID unit. So it was kind of scary.
How did your parents meet?
My dad grew up here, next door, and my mom grew up on the next street.
How did they contract it, or do you know? Or
No.
No idea?
They were very careful because we didn't let them go anywhere. I would run their errands, go buy the groceries, whatever they needed.
So you guys were taking it very seriously and whatnot.
Yes.
Yeah.
But they wouldn't let my parents go anywhere.
So it had to have been one of us, somebody, who brought it over here. It's just to fix you.
got it.
We all had something different going on.
So what kind of symptoms did you have?
I had the fever, the headaches, the body aches, the congestion. I couldn't smell, I couldn't taste.
Me either.
And how was the process when your parents, how did they find out they could start getting symptoms?
My dad suffered a lot from allergies and sinuses, so we were assuming that's what he was going through.
And how did they get tested? With their blood or the nasal?
Nasal.
And how long did it take to get the
We
the
found out
results?
right away.
What happened then?
The doctor came out to tell my parents. They both tested positive. Is it bad enough to send them to the ER? He says, no, not yet. Just monitor them. So he says, just take Tylenol and just to keep an eye on their oxygen. So 2 days later, yeah, my dad got really bad. What happened with my mother, she was not as bad. And she had forgotten to take some of her medication at night. So she called her doctor and the doctor said, I don't like the way you're breathing. Go to the ER. Well, my mom didn't want to go because she always had the mentality, if I go to the hospital, I'm not going to come back out. She didn't want to, but she said, you know, I need to go. We dropped her off at the ER. My dad, when he was sent to the hospital, he went straight to the ICU. But my mother, she was in a regular room. And what happened with my mom, she got worse because she was so worried about my father that she would cry and cry because the nurses would call me and tell me, your mom keeps crying and crying. So I would call her and say, Mom, Dad's doing better. And she thought that we were telling her that so she could get better. And she thought we were lying to her about my father. I tell her, Mom, you know, he's doing okay, Mom. He's hanging in there. You know, you've got to get strong. You got to get better. And, you know, she wouldn't believe it. She thought we were just saying that so to make her feel better. I think that affected her more, her lungs and her breathing, just because she wouldn't catch her breath, you know, because she was always crying. And, well, then a few days later, she ended up in the ICU as well. He ended up in the less severe where my mom was, but he was still sedated, but he had shown signs of improvement. So, you know, we were very optimistic. The doctor had even told me, he goes, I know your dad is very strong because he has been here the longest with being this sick. Then the night before they passed, I got another call in the middle of the night. You know, the doctor said, we think this is it. You know, your dad, his lungs are just not working anymore by themselves. He goes, it's all the ventilator. He's not doing it on his own at all. We've tried.
Was Mom on the ventilator as well?
Yes, she was on the ventilator. It was about 2:30 in the morning when they called me. So then I called all the family, so we gathered here, and yeah, and we did a Zoom with them, and you know, we told them, you got to keep fighting, Mom. You got to keep Dad, you know, because both nurses were able to do Zoom meeting with us, so we could talk with them and see them. So about 6:30 in the morning, we got another call, and we thought, this is for my dad. And the doctor called and said, no, I'm calling about your mom. She's in full cardiac arrest. He goes, we've pumped every medication we can, and her blood pressure just keeps dropping. He goes, what do you want us to do? I said, do you want us to do chest compressions? And we're like, no, let them go. They want to go. They want to go. And she doesn't want him to go by himself because my dad was already losing his battle for a while. So they said, okay. And we got another call later on at 7 o'clock. They had both passed. In separate rooms, different nurses, and it was 7 o'clock that they had both been recorded.
Was not going to let Daddy go by himself.
So you weren't able to even visit it?
No.
At all? And then you never saw them physically again?
No.
Wow. I'm really sorry for your loss, honestly. It's like they were connected and
So connected.
very powerful. Thomas Aaron Peña.
Yes, sir.
Funeral director here at the Garden Funeral Home. Do you believe that COVID has attributed to an increase in death?
So in February, we didn't really see too much of an increase, but say like in March.
Like what kind of percentage or numbers wise?
I would say like us as a funeral home personally, we probably increased like another 20 bodies a month, and a lot of them. So normally we do probably about 40 cases a month. During COVID, we were seeing like 65, 70 cases every month, with almost half of them being COVID cases. We do cremate a lot of COVID cases, but you do have your families that still want to bury. But when they do choose to bury, it's something difficult for them.
This virus is more deadly. It's roughly 10 times more deadly than influenza. The numbers shift a little bit depending on region and metrics. But what you end up getting is a virus which is 10 times more deadly. 1 in 1,000 people is going to die from the flu. The number is 10 times that, 1% from this virus. That's a big difference. The other thing about it is that you have this weird phenomenon of a large variation of the disease. So 80% of people don't get that sick. So about 40% don't even know they're infected. Another 40% are going to get sick. They might have long, weird recoveries, but they don't need to go get hospitalized.
The problem is that 20% of the people infected with COVID-19 become super sick. And they're the ones that are clogging up extended stays in the hospital. At that moment, the virus affects many organs and tissues and produces a high risk of death. So hospitals get filled up, and this creates a medical crisis. If we weren't getting a lot of people sick, we wouldn't care. It would be wildly infectious, but not consequential. The other problem is that COVID-19 is hugely contagious. 80% of people don't get that sick. Someone doesn't even have symptoms, but they're infectious. So they're roaming around. They can have more than 14 days of incubation when they're still contagious. And that makes it hard to control the virus. And that's why it got into all these nations, bringing it silently without showing symptoms in their bloodstream and their lungs, traveling from city to city, from nation to nation, from one person to another.
Was 2020 not a bad timing to be hit by the COVID-19 pandemic? Did we make a mistake misjudging this invisible enemy? Did we as a nation take actions in the right time?
Thank you so much, Alex, for taking time from your busy day. I know it's been a crazy time, and we appreciate you being able to share your story and your insight on COVID and its impact on our health and our economy.
Yes, I'm involved in a bunch of spaces. Some of them are new, post-COVID, and some of them are old, pre-COVID. So I'm involved in education, travel, technology, and now COVID technology and health safety.
Do you think the government did respond quickly enough with giving relief to businesses or on a healthcare front?
So I think the government started strong and has got weaker. And right now there's so much bickering that's preventing anything getting done.
As we have seen, politicians can't seem to agree and bring to the table contradictory information, which continues to confuse the population.
61% of the voters approve of Trump's handling of the coronavirus.
On the healthcare side, we're not unique. Every country in the world, bar Korea and a few of others, has failed to actually adequately deal with this.
Nations rely on their leaders to come up with effective plans to overcome crisis and emergency situations. One leader can influence another in a good or bad way. These are just some examples of poor leadership and a lack of compassion towards their people.
You said you didn't need to ban public gatherings, and then you did.
No.
The government said we didn't need to wear face masks, and now we do. You didn't pursue community testing, and now you say that's vital. Isn't this a story of delay that sadly cost lives?
No.
President Bolsonaro continues to downplay this pandemic even as the number of deaths reported in Brazil surpasses China's.
Particular, pelo meu histórico de atleta, caso fosse contaminado pelo vírus, não precisaria me preocupar. Nada sentiria ou seria, quando muito, acometido de uma gripezinha.
And what happens is we go for momentum politics or news politics, which is extreme lockdown. Everything is extreme this or extreme that. The reality is we know what works. And truthfully, if you can do a combination of testing well, quickly, contact tracing well, and proper measures for what you do discover, you're going to deal with 80% of the problem anyway.
I think that there's so much conflict of, one says one thing, somebody says another, nobody knows what to believe anymore.
Many doctors think it is extremely successful. The hydroxychloroquine.
Those trials show consistently that hydroxychloroquine is not effective
in the treatment of coronavirus disease or COVID-19.
Hydroxy has tremendous support, but politically it's toxic.
So I wish they would just come together and come up with a certain standard that everybody can go with, and they'll respect it more.
Hi everybody, we're here with Commissioner John Mares. Are you happy with the government response on federal, local, and state level?
Everything that happened on the federal and state level impacted what we did locally. That loose interpretation that we saw at the beginning really hurt, I think, the state, and then it impacted counties like Nueces. And so I wish that the president would have set the tone a long time ago that this was serious. He's saying it now, and how much of that could have been avoided had we had better regulations coming from the top.
Had we had better systems in place, many deaths could have been avoided. But unfortunately, Donald Trump's administration dismantled the Pandemic Response Agency shortly after taking power.
My first question is, you said that you don't take responsibility, but you did disband the White House Pandemic Office, and the officials that were working in that office left this administration abruptly. So what responsibility do you take to that? And the officials that worked in that office said that the White House lost valuable time because that office wasn't disbanded. What do you make of that?
Well, I just think it's a nasty question, because what we've done is, and Tony has said numerous times that we've saved thousands of lives because of the quick closing. And when you say me, I didn't do it. We have a group of people. I could ask perhaps my administration, but I could perhaps ask Tony about that, because I don't know anything about it. I mean, you say we did that. I don't know anything about it.
You don't know about the reorganization that happened at the National Security
It's the administration.
Council.
Perhaps they do that. People let people go. You used to be with a different newspaper than you are now. Things like that happen.
But this was an order.
Please go ahead. We're doing a great job.
We didn't have a national mandate of slowing down work. It was kind of let 50 states do their own thing, and so now we had the state of Texas that had a mindset of at the beginning, which was kind of there was a lot of things they didn't want to do. They didn't want to shut down business. They didn't want to put out any kind of mask order. They put it all on the local authority, and so at the county level, we were faced with making a lot of the decisions that weren't being made where they should have been.
Here with Doctora Laura Murillo, the President and CEO of the Houston Hispanic Chamber of Commerce.
Well, thank you, Ricardo, for this opportunity. We have all endured some tremendous challenges. At least 20% of the businesses that have already closed among Latinos here in Houston will not be coming back. 42% of them had to lay off people. In Houston, we have over 100,000 small Hispanic-owned businesses. We're talking everything from people who are operating out of their vehicles to sell food trucks to establishments of tires, floors, etc. And so we know this is a huge, huge void in terms of some of those small businesses that will not be coming back.
Between March and April of 2020, mass layoffs and business closures had already occurred, just a few weeks into the crisis. The majority of businesses plan to seek funding through the Coronavirus Aid, Relief, and Economic Security CARES Act. However, many anticipated problems with accessing the program. But it didn't have to be like this. There are currently many solutions being studied to bring not only the economy back up again, but also to lift the spirit of entrepreneurs and warriors who have devoted their lives to building a family business or who have established a career to conquer the American dream.
It's an impossible situation, but that was back in March. We've had this long enough now that it's time for some responsibility. Understanding nothing is perfect, but you know what? Adapt and learn, pivot and learn, be a businessman, look at what works, look at what fails, and learn from best-in-class practices. The entire world is an example for good and for bad. So why are we not paying attention to what works and what doesn't?
Hi Priscilla, thank you so much for having us here in your office and being able to learn your story and how COVID has impacted you, your family, and your business.
Well, thank you for coming. This is very exciting to have somebody here in our business. We haven't had anybody in the building since March, so glad we get to utilize the space. We actually shut down March 17th, so just me coming in and working from here and then cleaning and stuff like that. So you're the first people we've had here.
How many employees did you have before COVID hit?
We actually had 17 employees, and then in June I had to do layoffs. So it's a family-owned business. My mom or my tias who work with us and cooking in the kitchen, and now that seeing everything just empty and the shelves empty, it's a little hard.
Do you think that the government has done a good job with handling COVID and helping businesses such as yourselves, or you think it's kind of discoordinated?
I don't want to step on any toes, but I can only be honest. There was a Harris County application for aid, and they wanted audited financials. This is for small businesses. What small business has audited financials? That's $10,000, $15,000, $20,000 just to get those, and they wanted them for 3 years. I'm going to pay more just to apply for $10,000. There's little things like that that I know they don't mean. Like, I know the intent is there. They want to help, but if they don't know, they don't have somebody who's telling them this is not going to work. They need better consultants, I guess. Maybe talk to the people actually who are the small businesses.
Over 3 million Americans filed for unemployment by the end of March 2020, caused by a surge in layoffs due to COVID-19. According to Business Insider, more than 99% of all businesses are small businesses, and they employ about half the U.S. workforce.
I can tell you it's a very unacceptable situation when you have a business that's healthy and suddenly you're getting a call from your bank who realizes you're heading towards zero and says, what are you going to do about it?
There are efforts being made to balance how much credit is given out to businesses and individuals in order to maintain the economy flowing. Joseph Rubin stated that since March, the banks have been given a lot of leeway to work with borrowers to solve short-term liquidity issues through forbearance or reduced loan payments. This accommodative stance will continue until the end of 2020, or 60 days after our national emergency is terminated, unless the regulators and/or Congress extend the relief.
And there's no answer, right? But it's worse than that, because originally the SBA and the PPP financing was covering you if you had contractors, covering you if you had employees. We have contractors, we got zero.
An idea may spark in the middle of the darkness and can light up an entire movement. Let's come together and never give up.
I think the approach could have been a shorter, subsidized time that we would have been out of work, everybody. That would have been paid by the government. Everybody could have lived off of that, and then the numbers would be reduced and we could have gotten back to normal or a more normal way of living, and businesses wouldn't have been hurt as much. It's kind of like ripping the Band-Aid off real slowly.
I think one of the challenges has been the different voices coming from the national, the state, and the local elected officials. Fortunately for Houston, locally, we've had a mayor and a county judge who have been on the same page, certainly asking people to wear masks and to follow guidelines, data, and science.
But if our leaders do not heed the advice of science and the doctors and the experts and make it political, then we're going to fall in the same trap again.
And new waves of infections will be imminent. Are we ready to face a new outbreak? Have we learned the lesson?
The U.S. is not out of the woods and is at risk of a resurgence of coronavirus.
Many parts of the world are currently seeing what could be a second wave of COVID-19 infections.
New cases have been surging in recent weeks across the continent. France is taking drastic measures to stop the spread.
We have a problem in America in the sense that when we look at COVID, a lot of the second wave has come from a failure of testing. And the failure of testing hasn't been, do we test, do we not test? It's how do we test?
By downplaying the virus, cities and states were left to their own devices and faced shortages on supplies for testing and prevention of the coronavirus. Mayor Durkin in Seattle faced severe conditions that were also reflected nationwide.
I think as a region and as a state, we do not yet have enough testing capacity. Because we did not have adequate testing, both because of the CDC rules about who could get tested and the very few numbers of test kits we had, we really missed how widely and quickly this disease was spreading.
Inadequate testing can lead to a situation similar or worse to what Governor Jay Inslee endured.
Washington Governor Jay Inslee says the state is now bracing for an explosion of cases.
In 7 or 8 weeks, there could be 64,000 people infected in the state of Washington if we don't somehow slow down this epidemic. And the next week it'd be 120,000, and the next week it'd be 250,000.
So if we test people and we need a lab result and it takes a couple of days and we don't test asymptomatic people, then A, you miss half the people, and B, by the time you get the results, people have reinfected other people. So ultimately, if you can come up with a solution that starts with a labless test and moves through safety products, you can actually reopen businesses, preserve jobs, and preserve safety. It's not an either-or situation, but at the moment, people seem to see it only in black and white.
I hate that the kids right now are being the guinea pig, right? Because there's major corporations. City Hall, it's empty, but the schools are filled. That just doesn't make sense to me.
A student at an elementary school tested positive on the first day of school. A teacher at another school also tested positive.
I mean, that's the reason why I personally have my kids in homeschool, because I just wouldn't feel comfortable working in a clean office with an air purifier while they're sitting in a classroom with who knows what type of air purification or safety standards. You can't expect the teachers to teach and guard them nonstop, because it's all it takes is one little slip and then the whole classroom is sick. And so you can't expect that of the teachers.
We reached out to Dr. Paula Madrid, a mental health professional who gave us a deeper look into how the current day-to-day normality is affecting children and adults.
I'm a professional mom who runs a couple of businesses in addition to being a psychologist. And so I think that managing the many demands of kind of motherhood and professional demands has been somewhat challenging. But I really, as always, I try to focus on kind of the positive, which is that I get to spend more time with her.
As a professional, your professional opinion, this lockdown, do you think this is going to cause like a post-traumatic stress in people?
Post-traumatic stress disorder is caused by very different things. So, I mean, we can talk about trauma and we can talk about PTSD, which is post-traumatic stress disorder. Those are completely different things. One is an actual diagnosis that is PTSD, right? It's a diagnosis that is given after a person experiences a severely traumatic event and failed to cope adaptively with it, right? So that's really like the extreme version. I don't think that being in a lockdown, being in a pause or staying at home will cause PTSD. It has, and it will always cause, of course, a great deal of stress, of course, anxiety, because there's been a lot going on in addition to the actual pandemic. So I think it's kind of important to keep in mind, what the impact will be, right? Or has been. Those who were always more vulnerable, those who had less resources, those who had less ability to escape, to have access to whatever food they wanted to be delivered to their home, are going to suffer much more. If we look at it that way, it is a significant crisis for many, many folks in the world and, of course, in our country.
People don't think it's real, but it's real. Most of us got the virus and people don't want to do anything about it. But every time somebody asks me about it, I said, you protect yourself, because is this real?
A lot of people, when I talk to some people, they're like, oh, I don't have to wear a mask, and you walk into a store.
I've had people come to my office and they're like, they want to come into the office, and I'm like, no, you can't. And they're like, come on, this crap is over. And I said, no, it's not.
Hey guys, so we're outside the Houston Health Department. My team tried to contact them to see if we can get an interview, speak to somebody, just to learn what's going on and see the impact of COVID-19 on the health of this community. I guess nobody's here. we repeatedly attempted to contact the CDC in Texas as well as the Houston Department of Health by email, by phone, and we also visited their facilities in person to try and get their point of view and understand what went wrong. Still, they never answered. They pushed back the interviews or declined to comment.
So then, COVID has become a wake-up call for us all, in which we have realized that borders between countries, differences in gender and race, and socioeconomic status do not exist. We all have been forced to slow down and reflect on our sympathy, kindness, virtue, and perhaps appreciate what is most important in life: family, love, and the people around us.
Because of them, we have this urge to find the solutions and answers so that we can be reunited and stay together without fear.
The world is under extreme pressure. Everyone is experiencing pressures that they have probably never had before, or added stressors. And so what I say is, for now, we can always be supportive. We can provide words of wisdom if we have them. We can help people relax and calm. I think we can also just kind of empathize, right? We can always encourage people to engage in meditation, in techniques that help with anxiety, with stress management. Some of these techniques are easily kind of obtainable. I mean, they're available. There are books, there are apps. There's so many ways in which people can begin the process of kind of healing.
We believe at the Houston Hispanic Chamber of Commerce that we must be practicing an opportunity not only just to open up business, but to do it safely. And we believe they need to and they can go hand in hand. It's not one or the other, it is both. The companies that did pivot, that perhaps were in, as I like to say, in one sector, one of our members, he produced lubricants for cars and figured out how to produce sanitizer and masks and to keep his company afloat. And so, again, I believe entrepreneurs are resilient, they are smart, and those that are really able to figure out the needs of the community, the needs of our city, are going to be okay.
Other companies know that, they're not alone, and it's not about, competing with each other. It's about getting us all through this. We have to do what's right for our families, for our businesses, and for the community in general, and we're all going to get through it, and we can only do that together because we're all connected.
I have a friend in New York who's a serial investor, very smart guy, and he says to me, when he hears I'm involved in schools, he's like, why are you involved in schools? Schools are dead. Are they ever coming back? And I'm like, really? Are schools ever coming back? Are we going back to the caves? Are we going to be cavemen? Of course, schools are coming back. Society is coming back. This too shall pass, and it will pass sooner than we think it will pass. And at that point, we have to come together, which is a really critical thing.
This has also been a time of change, a time of renewal, a time of pause, and a time during which they can say, well, what do I want with my life? How can I make things better? What can I learn during this time?
Wear your mask, keep your distance, be vigilant with your loved ones, take care of your kids.
Mankind is unstoppable. Solutions are being developed by companies and institutions that have visionaries to lead the way, entrepreneurs that strive to give us back our normality, and dreamers who hope for the best outcome. Thank you so much for your extraordinary work that you're doing. I think it's needed now more than ever. Can you briefly explain what you're currently doing and what your company does?
My company is an antibody engineering company. This year, we applied our technologies to go after the novel coronavirus. We worked on an antibody, and what the antibody does is you take it as an infusion, and the antibody will go and grab the spikes that surround the virus, and they'll grab onto them so those spikes are no longer able to stab into your cells and infect you. The second way we're formulating our medicine is in an injectable form. So the idea is that the first day you feel sick, or before you even have symptoms and you just have a positive test, you get a shot, and you get the antibodies, and they stop the virus before it even has a chance to make you sick in the first place. And so we get a 97% reduction in virus in the lungs within 48 hours, and a bunch of the lung pathology goes away. Where we are right now is in manufacturing, getting ready to run the human studies that are coming up in a couple months.
Ideally, you want to kill COVID, because the problem is people putting masks on, taking them off, Masks are everywhere, particularly my kids. It's not necessarily hygienic. And so COVID can come even on the on-off thing. So COVID killing is very important. And that's just effectively a treatment for the mask. It's natural. It gives you an advantage. The third piece is, and this is more important now as we head to winter, bacteria killing. What about pneumonia, stuff like that? No mask out there does it, but you can do that as well. So if you've got those three things, that's a big deal. The fourth thing, which as I say is questionable, which a lot of hospitals do, is reusable masks. It's not great from an efficacy perspective. How are you going to reuse it? How are you washing it, etc. But frankly, if you get those first three things, you can make it cost effective, you're done. And so we've been looking for a mask that retails at under $1 that does all three of those. Now we have it.
So the main message that I think the publisher know right now is that the medicines are coming. We're going to have vaccines. They will help prevent people from getting the virus. And we will also have antibody therapies that if they are sick, it will protect them from getting worse. That'll help them recover and go home.
I can say that I don't have the answers to what will come tomorrow. But we must make the best version of ourselves every day for a better future. Today, we must plant the seeds for a better tomorrow. So we can renew ourselves, adapt, remember, we are the Earth Walkers. And let us come together as a global community, facing a global threat. Our strength in coming together is unbreakable. And there's no greater threat that we cannot overcome. And we must remember the most important theme: be resilient.